Um, Today I'm going to talk about a topic which is very much talked about, very much spoken about, and it's very much alive in all of us, which is depression. In this video, I'm also going to talk about how we who are not qualified, who are neither a psychiatrist nor a counselor or nor even a psychotherapist, how we as common family person, how can we support someone who might be feeling depression? So let's understand the rule of thumb to support someone who is in the phase of depression is not asking the why question. So if the person is going on to say that I feel like crying, please refrain yourself for asking the question, why do you feel so? The second tip of supporting someone who is experiencing this depression is to understand the difference between depression and sadness. So, sadness is a mental state, might have some or the other reasoning to feel that mental state. It is often characterized by low self esteem, low energy, and a hopelessness. Though the symptom of sadness and depression are more or less same, however, depression is not equal to sadness, because in depression, the first thing, it is not a mental state, it is a chemical problem or unusual chemical reactions which is happening in brain and body. So it is not as equal as a phase of sadness. Okay. The other thing, the third tip of supporting, so the how to support someone is to understand the difference that it might be a sadness or it might be a depression. And because we are not qualified, let's not conclude, let's not announce whether it is a sadness or depression. So the second tip is to understand the difference of sadness and depression, and also understand that if sadness increases its time lapse, it might turn up as depression. So losing someone near and dear might trigger something in me which is called sadness. And the grief period might take from 6 months to 1 year in case of sadness. But if it is increasing more than a year or so, and yet I'm in that state of sadness, then it is not a sadness. It might turn up as a depression. So we as a family member or a loved ones, if we are observing someone whose time lapse of sadness has increased its due time, it is high chance for us to start speaking up. And by that, here comes the third tip. I have been hearing so many of my fellow colleagues of counseling and similar field are putting their posts that I urge all depressed people to speak up, and we will be lending ears, and please speak up for your challenges. There's nothing in this world who can't be resolved. My invitation to all of them is to understand and relook at what are we inviting. Because if a person is depressed, the prime factor is their inability to express what they are feeling. And because they couldn't express, they are in insulting everything, whatever is going inside. If they could, they would. So therefore, before inviting them to speak up, to encourage them to speak up, can I recheck the trust environment which I might have created for them to speak up? And here comes the fourth tip. Any depressed person will refrain themselves from expressing what they need. And therefore, it becomes our moral responsibility to create an environment of trust and openness where they can speak up. So, as a family member, we should and we must create that environment. And how do we create that environment? Which is the sixth tip of today's. You will never ever create a trust of an environment of trust by invalidating what the other person is saying. So, for example, if I am feeling depression and I feel that corona, so for example, the statement looks like, I feel this, I feel scared. I'm absolutely scared and I feel that corona will take away my job. I, as a family member, need to validate the emotion what the other person is feeling. So instead of saying, ऐसा कुछ नहीं होगा, can I say, isn't it a normal feeling for all of us? Like, we all are scared. Of course, we are scared. This is something which is scary. So you're not alone. Just by giving them a validation that they are not alone, we are creating that environment of support and trust wherein they can start re-establishing their lost belief. So the seventh tip, what is coming to my mind is not to, or maybe, just to be there for them. And here comes the most physical presence. So possibly that the other person is not in the well-being state and therefore they need you. They might not even realize that they need you. Or sometimes even worse, they might be in a denial or they might push you away. And in that moment, you have to be really there physically. So just by being present around them physically will somehow give them a sense of trust, a sense of containment, and a sense of belongingness. So, as a family member, how to support? By being physically present around them, not leaving them alone, will make a huge difference of creating that environment of trust and openness. And once that is created, the half battle is already won. When the time comes, you may use all your communication skills and possibly ask and possibly gently invite the person to seek professional help. And I would again reiterate, please refrain yourself from diagnosing yourself